What does genotype mean for sickle cell inheritance? Imagine your genes as a set of instructions passed down from your parents. When it comes to sickle cell disease, your genotype is the specific combination of these instructions that you inherit. Every person gets two copies of the hemoglobin beta gene, one from each parent. These genes determine the type of hemoglobin your red blood cells produce. The normal gene produces regular hemoglobin, called hemoglobin A, while a mutated version produces sickle hemoglobin, known as hemoglobin S. Your genotype is the pair of these genes you carry. If you inherit two normal genes, one from each parent, your genotype is called hemoglobin A. This means you do not have sickle cell disease or trait. If you get one normal gene and one sickle gene, your genotype is hemoglobin As. This is called sickle cell trait. People with sickle cell trait usually do not have symptoms, but they can pass the sickle gene to their children. When both genes are sickle genes, the genotype is hemoglobin SS. This means the person has sickle cell disease, which causes red blood cells to become sickle-shaped. These misshapen cells can block blood flow and cause pain, anemia, and other health problems. There are also other combinations, like hemoglobin SC or hemoglobin S with beta thalassemia, which can cause different levels of severity in sickle cell disease. The inheritance pattern of sickle cell disease is called autosomal recessive. This means a person needs to inherit two sickle genes, one from each parent, to have the disease. If only one sickle gene is inherited, the person has sickle cell trait and usually no symptoms. When both parents have sickle cell trait, each of their children has a 1 in 4 chance of inheriting sickle cell disease, a 1 in 2 chance of having sickle cell trait, and a 1 in 4 chance of inheriting normal hemoglobin. Understanding a person's genotype helps predict the risk of passing sickle cell disease to children. It also guides genetic counseling and testing decisions. Knowing your genotype explains why sickle cell disease can vary so much in how it affects people. It shows how the specific genes inherited from your parents determine whether you have sickle cell disease, trait, or normal hemoglobin. This knowledge is essential for understanding your health risks and making informed family planning choices. Always remember, for personalized advice, consult a healthcare professional who can interpret your genetic information accurately.